everyone, Dr. Nicole here. Welcome back to our Voyage to Vitality series. Today we're going to talk about the chewing system. More specifically, we're going to talk about something that a lot of people don't really understand or is completely misunderstood, which is temporomandibular joint disease. What a big word. Temporomandibular joint disease is also called TMD, TMJ, I click, I pop, something like that. That's most of the time how people come in and tell me what's going on. So before we go into what is TMD or TMJ, we want to talk about, what it's made of, the parts of it, and then talk about root cause of what's causing the issue. Okay, so what is the temporomandibular joint? So just to go back and explain what a joint is actually the way the body connects two bones together. Sometimes there's just fluid there, sometimes there's cartilage in between, like a disc, like a meniscus in your knee, okay? And what it allows the body to do is have the bones move with muscles, and you are able to walk, you're able to run, you're able to chew, you're able to smile. That's what the point of the joint is, okay? So the temporomandibular joint is made of the skull bone. It's made of the joint itself, which actually has a collagenous disc in it, which we call a disc, or I like to refer to as the TMJ meniscus. It's made of a jaw joint, or jawbone, the jawbone here, okay? It's made up of muscles because that's how the joint moves. And I know this sounds very awkward, but it's also made up of teeth, okay? It's obviously the teeth are not part of the joint itself, but they directly influence the joint, because if you move your teeth side to side, your teeth get in the way. They limit where the joint can move to. So it actually has a direct implication of what happens with temporomandibular joint disease, or TMJ. Okay, so when people come in, it can show, the reason why TMJ or TMD is so confusing is because it can be caused by a bunch of different things. So what do I mean by that? I just went through a whole bunch of stuff that the joint is made of, right? The joint's made of the joint stuff itself, the disc, the bones, the muscles, the teeth. So when people come in and say, well, I have TMJ, what they're actually saying is there's a dysfunction of all of these things going on, but it's showing up as one symptom. Okay, for example, people come in, they'll say, well, I'm clicking and popping. Or they'll come in and they'll say, oh, well, my teeth aren't touching the same anymore. I'm getting really bad headaches. I lock open, I lock closed. These are different things that are showing me what temporomandibular joint disease is. So those are the symptoms. Now, what is it? Basically, it is a breakdown of one of the parts of the system. So it can be breakdown of the skull bones itself. It can be breakdown of the disc or the meniscus. It can cause the meniscus to wear away. It can cause it to tear. It can cause it to pop into a bad position. Okay? It can be breakdown of the jaw bones. It can be inflammation of the muscles, and it can be fracturing of the teeth. There are lots of people who come into the office who have fractured teeth, they have worn teeth, all these things. They don't actually get any pain, but it's telling me that they have temporomandibular joint disease. So how, in the normal way, do people treat it? Well, normally temporomandibular joint disease is treated with ibuprofen, is treated with muscle relaxers, is treated with wearing a jaw appliance, it's treated with physical therapy. Well, that's great, but these are wonderful ways of getting out of pain, but it's not really the root cause. The root cause of the problem is that there is some type of imbalance in the system. Okay, the imbalance is causing breakdown of bone, breakdown of jaw joint, disc, muscle inflammation, or problems with teeth. So we need to figure out what that root cause is and what is causing the imbalance. Now, before we all jump into, well, what are they and what causes it, we're going to have a whole other video on this, so we can't put the cart in front of the horse. But the point of today is just to let us know what temporomandibular joint disease is. So to recap, okay, your body has temporomandibular joints. They're made of bone, they're made of a disc, They're made up of muscles and teeth. And when there's dysfunction in them and people get pain, you get clicking, you get popping, you're unable to open, you're unable to close, you fracture teeth, you wear teeth, this is telling me that you actually have some type of dysfunction or disease going on with the system. Okay, so if you have any questions, don't worry, you can post them below. We'll try to answer. We will have another video on the unbalanced chewing system, so hang on tight. But until then, keep on brushing.